If you could have surgery and not have visible scars, would you be more likely to do so? I'm Dr. Angela Sturm. I'm a facial plastic surgeon, and scars are one of the things that really worry people. That's one of the things people ask about the most, because we've all seen people that their scars maybe didn't heal so great. And why is it that some people have more visible scars and bigger scars and not very pretty scars, and then other people you can hardly see it at all? There's a few things that you can do to make those scars better. And this may be a little controversial, but a lot of it has to do with your surgical technique. We all do things differently, but it's how you handle the tissue, how you close the incisions, and what you do during the surgery itself. One of the surgeries that I do that people are the most concerned about for scars is facelifting. So face and neck lifting in particular, because the scar can be imperceptible, but it is a little bit long. It can run from the top of the hair here, around the ear, inside the ear, around the back, into the hairline. And so that's a place that people don't necessarily want everybody in the world knowing that they've had a facelift, but you can't do surgery without having some type of scar. The biggest part of having good scars with a facelift is how you're doing the facelift. So if you're lifting the deeper structures, you're making sure you have that stability deeper than the skin, and you're not putting the tension on the skin itself. That is the number one thing that makes your incisions heal better. So it's your actual technique of doing the lifting that, number one, makes the lift last longer, makes it look more natural, and then also makes the scars heal better. That is one of the reasons that I switched from doing a SMAS lift to a deep plane facelift. When I was doing a SMAS lift, the scars would look really, really good for about a year or so, and they would spread ever so slightly, enough to where it bothered me, but the patients didn't usually notice or care that much. But it bothered me, and I knew that it could be better. So that's the number one thing, is how are you doing the surgery? How are you taking that tension off of the skin? So you want to have absolutely no tension, that whenever you lay the skin there, it lays very beautifully. You just sew the edges of the skin together. That is the other part of the surgical techniques, is when you sew the skin together, it has to be teeny tiny little sutures, and it has to lay flat. If it doesn't look beautiful on the table, it's probably not going to look beautiful afterwards. I don't really buy into this, oh, it was on the table, there was swelling, there was this and there was that. You know, it has to look good on table. It is experience that gives you that idea of what good on table looks like. In the beginning, you're going by what you've seen other people do, what you're going for, and then as you get more experience, you know, this is what good on table looks like. So you can look at that and say, yeah, that is going to be amazing. It's really important for your surgeon to very much take their time, be detailed, care a lot about the incisions and how they're being closed and how much tension they're under, how you're doing the surgery for you and for your particular anatomy to get you the best results. Part of it is the patient, and it's your skin. There's different skin types that tend to heal great no matter what happens. They heal beautifully. And unfortunately, the more birthdays you've had, the better the skin tends to heal. Oh, if you're younger, you have more collagen synthesis, you have more reactivity, you know, and so your incisions may be a little bit more pink, they be a little bit more raised for a longer period of time, and then eventually will fade out. But if you're have had more birthdays, it tends to lay flatter sooner and become a fine line a little bit sooner. So it's just the timeline of how long it takes to get there, as long as your surgical techniques are good. Those are things you can't really control as a patient, but it's something to know going into it, and to make sure you talk to your surgeon about, you know, what is my skin type? What do you expect that to look like? What should I expect downtime? So you know what is going to be the normal timeline for you, and what do you expect? Regardless of what your skin type is, it should end up a nice little fine line over time. And so I also don't buy into that of some people are just not going to have good scars and some people are going to have good scars. I think you get there. It's just how long does it take to get there? Some people, like my skin tone, will turn red initially for a while and then it fades out. Other people that have a little bit more melanin will turn more brown and then that will fade out as well. And there are a lot of different things that we can do that we have control over. So as a patient, following your surgeon's instructions is really important. Making sure your incisions don't get dry, don't get crusty, or doing all the things that you need to do. For me, I give you an antibiotic ointment that we use for a week, and then we switch over to other ointments and other creams at that point. After 3 weeks, I'm okay with using scar creams. Anything with silicone in it tends to be a little bit more effective than things that don't have the silicone. So that's my recommendations for my patients. You can also start non-surgical treatments if you want to, if you need to. I like to start it around 8 weeks so the incision is nice and healed. It's gotten the majority of its strength, and then you can start doing things like microneedling and lasering to get it that much better. This works really great in things like lip lift incisions that are right underneath your nose that tend to be in a little bit more visible place, or like facelift incisions that we don't want to announce to the whole world of what you had done. Things like CO2 tend to work really well, but also less invasive things like microneedling with RF are great, and regular microneedling works really, really well. And there's simple things that work as well. Just simply taking care of the incision, making sure you're out of the sun, making sure you use sunscreen, you're keeping it nice and moisturized. That works very well. Even massage, as simple as that sounds, if you just massage an area that feels a little bit more firm, that does actually help it lay flat and look good over time. So it's a combination of the things we control, of what the surgeon can do and what you can do, because we're a team working together to make this really, really good and imperceptible at the end. One of the important things I think overall, but especially with incisions, is having people around you that support you. The incision looking a little bit red or a little bit brown or a little bit raised is very temporary. All of these things resolve, all of these things get better, and as long as the people that you have supporting you and helping you through this recovery are on board with that and understand that, that will make the process so much easier, rather than someone that maybe is not as understanding and are pointing these things out and reminding you, oh, I can see this, oh, I can see that, and so that's in your head a little bit more, because the process it's a journey. It's a journey for the patient. It's a journey for the patients around them, that you've done this thing to look better, and you want to make sure you do look better. And so if you have that person that's constantly positive for you and cheering you on and like, you look amazing, and any bruising and swelling is temporary, that's going to be so much easier than pointing out, oh, you can see this incision and that incision, because the ones that people tend to point out, I've found, are so not noticeable to the normal person. Normal people don't look for incisions. They don't even know where they are for the most part. And so having that person who's really grounded and can help you keep grounded, because it is emotional, and it's something that you're looking for and excited about, and and want to have that really nice result. So the emotional support, I think, is important as well. So those are my main points as far as keeping your incisions looking good. This applies to all incisions. I really went over facelift because those are the ones that people are most concerned about, but honestly applies to incisions everywhere. And every surgeon has different techniques and has different philosophies and use different things. And so definitely follow their instructions. But overall, it's managing the things that you can manage. It's taking care of them the best that you can and making sure your techniques are cutting edge. So let me know if you have other questions, and you can find me at www.drangelasturm.com, or our podcast is Beauty Unveiled, anywhere you get your podcasts.